Okay, good morning, ladies and gentlemen. It's a pleasure to be here at Cannabis Business Asia Pacific Conference in Bangkok. I am Kohei Yamada, the founder and CEO of the first Japanese vertically integrated medical cannabis company, utilizing Japan's advanced plant factory technology. We are the best indoor farming team from Japan, led by Professor Kozai, the authority of plant factory technology, as well as the chairman of Japan Plant Factory Association. We are now based in a suburb of Bangkok City and cultivating pharmaceutical-grade medical cannabis, which will be certified for GSCP, which is Control Union Medical Cannabis Standard Gap. Is a leading certification standard for medical cannabis. So we are planning to provide our quality medical cannabis flower, not only Thailand, but also overseas market. First of all, I'd like to show you our cannabis plant factory introduction video. Our factory location is close to Suvarnabhumi Airport.
Our mission is sustainably making people healthy. We provide Japan quality medical cannabis to all over the world. It is safe, potent, and delicious, created by plant factory technology to achieve our mission.
植物に最適な環境を作ることができる植物工場は、医薬品グレードの高品質なカンナビスを育てるためのベストなソリューションです。
We are growing best quality cannabis with my over 20 years experience and knowledge, combining with plant factory technology.
We are implementing strict quality control based on data-driven agriculture and promote breeding optimized for indoor farming.
ไม่เพียงแค่คุณภาพนะคะแล้วก็การตรวจสอบกระบวนการเพาะปลูกย้อนกลับนะคะเราได้รับใบอนุญาตต่างๆนะคะตั้งแต่ใบอนุญาตเรื่องการขายนะคะการนำเข้าเมล็ดพันธุ์แล้วก็การส่งออกนะคะเราได้ปฏิบัติตามกฎหมายนะคะนี่คือคำว่า Plant Factory ค่ะ
It is our branded products, Kiseki, and our facility is around 2,000 square meters, and we have around 100 kilo per month capacity as dry flower basis. And we just took over one of the construction company in Thailand, and now we can provide this high standard plant factory construction to the clients, anyone who wants to enter in cannabis indoor farming. And here we have found that the environment, atmosphere is totally different from the California or Europe. It's so humid. So in order to provide pharmaceutical grade, very safe, standard, it's very important to control the environment. It's really hard to eliminate the humid cost. So we can provide our clients turnkey solutions, designing, constructions, so that we can provide healthy, safety cannabis flower to Thailand patients to all over the world. Well, sorry. So today, I'd like to talk about Japanese medical cannabis legalization and its opportunity. Japan just passed cannabis reform bill in 2023, last year, December, and it is expected to be installed by the end of 2024. This legalization will give us huge opportunities. First of all, the cannabis-derived medicine, Epidiolex for epilepsy, will soon be available in Japan. Secondly, not only Epidiolex, but also other cannabinoid medicine derived from cannabis can now be developed and produced in Japan. Furthermore, licensed companies will have the authority to cultivate cannabis for medical purpose. However, smoking cannabis flower, even for medical use, remains illegal in Japan. A stance that differs from the regulation in Thailand, US, Europe. So it is very clear regulation. Only prescribed cannabinoid medicine approved by Japanese FDA will be legal in Japan. I think that Japan has the potential to become one of the biggest cannabinoid medicine market, as well as a development hub. Since Japanese government doesn't legally allow people to access some cannabinoid components through cannabis flower by smoking, even for medical use. Okay. So, Japan's prescription pharmaceutical market is approximately 66 billion US dollar. As you know, cannabinoid like THC, CBD, CBN, CBG is expected to have efficacy for Alzheimer's, Parkinson, MS, anxiety, depression, pain, cancer, and so on. So now we have opportunity to develop cannabinoid medicine for those diseases in Japan. The revision will change the definition of cannabis from being regulated by the part of the cannabis plant to being regulated by the ingredient. For example, the matured stem and seeds of the cannabis is not cannabis according to current Cannabis Control Act. However, all the cannabinoid extracted from flower and leaf is cannabis, which is illegal in Japan now. The legal cannabinoid component like CBD will be removed from definition of cannabis, while illegal component like THC will be listed under the Narcotics and Psychotropic Substances Control Law and the Pharmaceutical Affairs Law. Well, however, it is illegal to tell the consumer the efficacy and the benefit of the CBD for the food or supplement due to violating of the Japan's Pharmaceutical and Medical Device Act. Any cannabis derived medicine in Japan has also been prohibited under the Cannabis Control Act until today. By changing this law, we are legally allowed to develop, produce, and use cannabis in the medical field. Since THC is a narcotic ingredient as a component, it is expected that pharmaceutical preparations containing THC above the limit will be distributed as a morphine under very strict controls, right? Distributed as morphine, medicine under very strict controls like morphine. The THC limit has not yet been decided by the government. There are two cannabinoid medicines in the world. Epidiolex for epilepsy has been approved by the US FDA, and Sativex for MS already approved by UK, Canada, and most of European countries for its safety and efficacy. GW Pharmaceuticals developed Epidiolex, and Sativex was acquired by Jazz Pharmaceuticals at $7.2 billion in 2021. One of the factors in the GW's success is the strict quality control of raw material production by plant factory. GW developed their own unique cannabis strain. They did breeding it especially for the Epidiolex in-house. Seeds undergo genomic variation. They need to obtain the exact same thing at the genomic level by clone cultivation for quality consistency. Cannabis must be grown in a completely enclosed space by control everything contained in the air, water, and medium to eliminate epigenetic influences. Therefore, they can always obtain plant materials with the same chemical components. Kiseki is the only one Japanese company which can do the same in cannabis cultivation. Since Japan legalized medical cannabis, Japan will legally allow cannabinoid medicine development. Japan has potential to become the biggest cannabinoid medicine market, so cannabinoid drug discovery venture in Japan will be a very exciting opportunity. In Japan, it takes as long as 9 to 17 years for a single drug to become available. In order to accelerate the clinical trials, I'm thinking if we can collaborate with companies that have pipelines of cannabinoid medicine which has already advanced to phase 2 or 3 overseas and proceed with the trials in Japan. I'd like to leverage this opportunity created by Japan's cannabis legal reforms. Cannabis-derived drugs are now permitted in Japan. I'd like to create Japan's first cannabinoid drug discovery venture with companies that already have the pipelines of cannabinoid medicine. I'm sure it also leads to creating a robust medical cannabis market in Japan. I want to make the most of what the law has given us to work with. If biochemical development of cannabis-derived drugs in Western world is what we have now, how can we leverage this to our advantage in Japan? I expect to move forward, hoping that more laws will be normalized in Japan. I think that this will take time a little bit, since Japan has a big stigma and no understanding against cannabis. Well, there are many patients in Japan suffering from epilepsy, MS, LT, to lack of the effective treatments. Cannabinoid ingredients are expected to have an efficacy for those orphan diseases. As a Japanese entrepreneur, I have a big passion to develop the cannabis-derived orphan drugs with cannabis pharmaceutical companies to save the people's life. Cannabis is a miracle medicine. My company name, Kiseki, means miracle in Japanese. Well, cannabinoid medicine development in Japan is a good opportunity for Japanese people to learn and understand the medical benefit of cannabis. I believe that it will lead and contribute to normalization in Japan and also save many people's lives too. Please contact me anytime in this exciting opportunity and venture in Japan if you have interest. Thank you very much for your kind attention. Thank you.